Welcome to the exciting world of prosthodontics. Prosthodontics is at the forefront of dentistry. It is the dental specialty recognized by the ADA that pertains to the diagnosis, treatment planning, rehabilitation, and maintenance of oral health in patients with missing or deficient teeth. This video is aimed toward those considering a residency in prosthodontics. Here we will address some of the most common questions of prospective applicants.
Looking for people who have motivation to be a prosthodontist, someone who's actually had some experiences that gave them the jazz, so to speak. So one question I always ask is, what one person or one event led you to want to become a prosthodontist?
We're looking for individuals who are enthusiastic about prosthodontics, all aspects.
Has a passion, desire, and heart for prosthodontics, willing to work hard and put the extra effort in to learn from their mistakes.
Individuals who come with great recommendations from their faculty.
So someone who's willing to work incredibly hard, and someone who has great attention to detail and just likes making stuff.
It is not an easy specialty, and we don't tell the applicant that it's an easy specialty. We tell them you're going to be working very hard, and you're going to have to be on top of all aspects of dentistry. And so
we're also concerned to find people who have incredible care and compassion for patients who have complex needs.
The specialty of prosthodontics is one of only 9 recognized dental specialties by the American Dental Association. It is the only dental specialty to also include a subspecialty, maxillofacial prosthodontics, which is an additional 1-year fellowship after completion of your prosthodontic training. A residency in prosthodontics is typically a 33 to 36-month postgraduate program. There are currently 34 dental school programs and 11 non-dental school programs, which can include hospital or military-based training. In addition to a specialty certificate in prosthodontics, select programs also offer a Master of Dental Science degree. Additionally, there is varying support for certification by the American Board of Prosthodontics across programs. Be sure to research programs thoroughly. Across North America, the cost of attendance for a PROS program varies significantly, but averages approximately $29,000 annually. This cost is somewhat offset by a supplemental stipend, which averages about $28,000 per year of residency. This varies among programs.
We offer a full gamut of restorative experiences, all the way from fixed, removable implant prosthodontics, as well as maxillofacial prosthodontics.
Full mouth rehabilitations, single and multi-unit implant restorations, and placement as well. Traditional crown and bridge, as well as veneers, kind of high-level aesthetic dentistry. We're also trained in implant placement, whether that is single or multi-implant placement, as well as full arch implant placement for traditional, kind of all-on-4 concept, as well as full arch prostheses. And then, of course, you have your traditional complete dentures, partial dentures, and typical operative restorative dentistry.
Everything from the placement of implants to the restoration of implants. On average, my residents are placing somewhere between 25 and 30 implants during the 3-year time.
We do everything. Single tooth placement manually, we do it guided, we do immediate loaded guided, we do full arch, we do full arch guided, we do almost everything that you can think of.
Our philosophy at UConn Prosthodontics is we view an implant as nothing more than a prosthesis. An implant is a prosthetic device. So it is just one method of replacing missing teeth. A patient with missing teeth can be replaced by removable prosthodontics, conventional removable, conventional fixed prosthodontic, or integration of implants. So we don't have a set number of implants a resident should be placing, but our range is usually between 45 to 125 implants. As a program director, I don't really care about numbers, but I do require residents to place a certain number to attain the skill set.
We offer implant experiences from surgical all the way through to prosthetics. On the prosthetic side, we are restoring patients for overdentures, partial denture spaces, single tooth implants, and large reconstructions on multiple implants. Our focus in our clinics has been primarily on implant dentistry, because that's where we see the field is at this stage in time.
Well, at UNC, a typical work week, it's a blur. You might be doing a little bit of a lot of patient activities, interspersed with research activities, interspersed with class activities. You're just trying to find the time in the work week to get everything done, but definitely I'd say our strong point is we don't sacrifice our clinical care, but we get a lot of other things done too.
A typical week for resident and prosthodontics. It's mainly centered in clinic time, seeing patients, treating them, studying a lot. You want to make the most out of those 3 years, learning as much as you can, and then surrounded by that, you're going to be having a surprisingly fun time at lab with other co-residents, with your friends.
So a typical week would be, about 70% clinic and 30% academics. In clinic, just your usual sessions, trying to get your cases done. And academics would be a mixture of lectures and classic and current literature reviews, and chances to review cases with your faculty members. But at night, it's a lot of work in the lab. You are your own lab technician, but it's through that kind of learning that you really get to know all the procedures. And even though you might not do all of them when you graduate, you really know how you can handle the case if any problems were to arise in the future.
So this is actually probably my favorite aspect of the specialty. Whether I'm currently waxing up something for a future case, or planning for future implant placement, or preparing provisionalizing some teeth for a patient, or maybe even doing some surgery myself with dental implants, or preparing an implant site. There's so many things that I find myself busy here with. And if anything, a typical week is usually a combination of all those things. And so it's definitely, you'll never find yourself bored in a residency program.
The best aspect of residency is definitely being in an environment where you're always at the sort of forefront of dentistry, whether that be with digital technology, with different new implant surgical techniques, different dental materials for the newest restorative dental materials. Being in this residency and academic setting exposes you to so much more than if you would get just being in private practice.
Best aspect of residency is, one, it's residency. You're treating patients who might not receive care anywhere else. Worst part, it's still residency. You're doing everything yourself. I would say there's not enough time in the day to get everything done, but it really is worth it for what we give. Being the only person to be able to treat a patient is really very satisfying, not just for the patient, but for us.
In terms of difficult things, it's always a balance. You have to find a work-life balance, and you have to put a lot of effort into putting energy towards everything. Again, you're learning, you're teaching, you're reading, you're writing, so just balancing everything, that's a tough part.
Really realizing how much prosthodontics can positively affect your patient's life. If you work very hard and you really put your heart into your clinical work, it's really amazing how changing someone's smile can really transform their life and make a really positive impact. And it's more than just the teeth. It's sometimes some of the lab work you have to do to get there, and all the hours for that. But honestly, I don't even think about that anymore. And it's more than worth it in the end.
I would say perseverance, because prosthodontics is a difficult discipline just because the more you know, the harder it gets. I always say dentistry is easy until you know what you're doing, and a prosthodontist knows what he or she is doing. So I would say perseverance to get the right outcome for our patients.
Traditionally, prosthodontists have been known for attention to detail. In fact, it's much more than that. Prosthodontists really must have commitment. Commitment to lifelong learning, commitment to the best patient care they can possibly do, and commitment to caring for and listening to and meeting the needs for their patients.
The most important quality which defines a prosthodontist is passion and commitment to excellence. So those are two main qualities I see in almost any person who applies for prosthodontic training or people who have graduated. And these are two qualities which will enable you to achieve the third quality, which is lifelong learning. This is a specialty which is changing every few years. We are in an exciting era of emerging biomaterials. So concepts which are current and look very exciting right now become archaic pretty soon.
Dedication to outstanding care, caring about patients, knowing complex treatment planning, sequence of treatment planning, and all aspects of treatment planning, knowing when to refer patients appropriately, and to have real compassion and understanding for the patients that we care for.
There are several important factors that you may consider when selecting a residency program in prosthodontics. Investigate each program's area of special interest to ensure they coincide with yours. This may include digital technology training, implant placement, and required residency laboratory procedures. Support for board certification. Programs may vary in their emphasis on board certification by the American Board of Prosthodontics. Additional program requirements. Some programs may have additional educational requirements beyond a specialty certificate. This may include a Master of Dental Science degree, teaching experiences, and other research obligations. Educational atmosphere. It's important to consider the personality and temperament of your potential co-residents, as well as the overall reputation of the faculty and the program. Other important factors you may consider include tuition and stipend status, location of the program, funds for professional meeting attendance, as well as other supplies or equipment which you may be required to purchase.
The future of prosthodontics, as I see it, is only going to grow. It's going to be so different than what we are currently used to training patients, predominantly driven by research in biomaterials. Another big change is embracing digital technology. Digital dentistry is here to stay. Digital dentistry will change the way we're doing things. Digital dentistry will make our life easier, and eventually it's going to benefit our patients.
Yes, I think the future of prosthodontics is looking outstanding. And the reason for that is because I think that in the next 20 to 30 years, there's still going to be a tremendous need and even an increasing need for the more complex type of care. And we're actually going to be the educators of the future for other dentists because we're going to have such a background in all aspects of patient care and patient-centered care. So I think the future of prosthodontics in the next 20 to 30 years is going to be absolutely outstanding. I think we're going to be the leaders in dentistry.
The future of prosthodontics is bright. So many people need the complex care that prosthodontists can provide. And because of the kinds of growth and change and innovation that's occurred over the last years, and the kind of innovation that will continue to grow in the future of the specialty is so exciting.
Well, I think the future of prosthodontics is phenomenal. The digital format allows us to do that with CBCTs, the digital radiography, the software we can plan the final restoration, the whole scanning process, the CAD/CAM design, all of that fits right into the training that we've been doing for years.
Prosthodontics is a healthy profession right now and a growing profession and will continue to grow over the next decades.
We hope this short video has given you a glimpse into the exciting world of prosthodontics. For more information on postgraduate training in prosthodontics, visit www.gotoapro.org or prosthodontics.org.